Generally, mandibular movement is categorized into two. The first one is the envelope of motion. This was introduced by Purcell in 1952. This envelope of motion explains about extreme border movements of the mandible in the sagittal plane. These guided movements are limited by the osteology and ligaments of the TMJ. The second one is envelope of function. It was introduced by Dawson in 1974 and it explains about chewing, function movement. The pattern of the movement is within the envelope of motion. Gibbs and Lundin in 1982 described that these functional movements are influenced by the joint, muscles, type of food chewed and the opposing teeth. Mandibular movement is limited by the ligaments and the articular surfaces of the TMJs as well as by the morphology and the alignment of the teeth. When the mandible moves through the outer range of motion, reproducible describable limit results, these is what the border movements is. Mandibular motion viewed in the sagittal plane can be seen to have four distinct movement components, which are 1. Posterior opening border. 2. Anterior opening border. 3. Superior contact border. 4. Functional. Among all of the above, only functional movement is not considered as border movement. This is because functional movement is not determined by an outer range of motion. The posterior and anterior opening border movement is limited by TMJ's ligaments and morphology. Superior contact border movement, otherwise is limited by occlusal and incisal surfaces of teeth. Functional movements, although not in the range of border movement, it is limited by the conditional responses of the neuromuscular system. Posterior opening border movements in the sagittal plane occur in two phases. In the first phase, from the maximum intercuspation position, the condyles are stabilized to CR position, which is the most superior condylar position. With the mandible still in CR, when mandible is depressed, movement is a pure rotational movement with no translation of the condyle. This can only be to a distance of 20 to 25 mm as measured between the maxillary and the mandibular incisors. And at this opening distance, the TMJ's ligament tighten. With this tightening of ligament, continued opening results in anterior and inferior translation of the condyles. And the axis of rotation of the mandible shifts into the bodies of rami, resulting in the second phase of posterior opening border movement. What happens in second phase is 1. The condyle are moving anteriorly and inferiorly. 2. The anterior portion of the mandible is moving posteriorly and inferiorly. Maximum opening achieved when capsular ligaments limit further movement at the condyles, which is in the range of 40 to 60 mm between incisor edge of maxillary and mandibular teeth. This slide summarizes the posterior opening border movements in the sagittal plane for both first and second phase. Now let's talk about anterior opening border movement in sagittal plane. After mandible maximally opened, closure of mandible is accompanied by contraction of the inferior lateral pterygoids, which keep the condyles positioned anteriorly, and anterior opening border movement occur. Theoretically, if the condyles stay in the same position upon closing of mandible when lateral pterygoid muscle contracts, pure hinge movement can occur, that is from maximally open to the maximally protruded position. But, if you remember slide number 20, movement of anterior opening is limited by the ligaments, and this tightening of ligaments produces a posterior movement of the condyles. Whereas the border movements previously discussed are limited by ligaments, the superior contact border movement is determined by the characteristics of the occluding surfaces of the teeth. Throughout this entire movement, tooth contact is present. Its precise delineation depends on 1 amount of variation between centric relation and maximum intercuspation. 2. The steepness of the cusp inclines of the posterior teeth. 3. The amount of vertical and horizontal overlap of the anterior teeth. 4. The lingual morphology of the maxillary anterior teeth. 5. The general interrelationships of the teeth. Since this border movement is solely tooth determined, changes in the teeth will affect on the nature of this border movement. In CR, condyles articulate with the thinnest avascular portion of their respective discs, with the complex in the anterior superior position against the slopes of the articular remnants. This position is independent of tooth contact. Only one or more opposing pairs of posterior teeth is in contact. When muscular force is applied to the mandible, a supero-anterior movement or shift will result into maximum intercuspation. This slide usually occur in 90% of population, meaning only around 10% of population has no discrepancy, that is only 10% of population has maximum intercuspation equal to CR. The average distance is usually around 1.25 mm. This picture on the right shows the relationship of the teeth when condyles in CR, while on the left shows relationship of the teeth when CR shift into maximum intercuspation. When mandible is protruded from maximum intercuspation, contact between the incisor edges of the mandibular anterior teeth and lingual incline of maxillary anterior teeth results in anteroinferior movement of the mandible. The picture in the slide shows the contact of the incisor edges of mandibular anterior teeth with the lingual surfaces of maxillary anterior teeth, which creates an inferior movement as the mandible moves forward, causing the posterior teeth to disocclude. When mandible continue to move forward until maxillary and mandibular anterior teeth are in edge-to-edge relationship and beyond the incisor edges of maxillary teeth, a horizontal line is formed. The figure shows a forward movement of mandible as the incisal edges of maxillary and mandibular teeth pass across each other. Now, when mandible continue to move forward until the anterior teeth pass way beyond the end-to-end position, the posterior tooth contacts results. Once the posterior teeth are in contact, the occlusal surfaces dictate the remaining pathway to maximum protrusion, which joins the most superior position of the anterior opening border movement. The figure in this slide shows the continued forward movement of mandible determined by the occlusal surfaces of posterior tooth surfaces until maximum protrusion. This maximum protrusion later joins the most superior point of anterior opening border movement. Here is the slide showing superior contact border movement when CR equals to maximum intercuspation. Now we move on to functional movement in sagittal plane. Functional movement occurs when mandible is in function, and this usually requires teeth and maximum intercuspation. The movement is considered free movement as it takes place within the border movements. Usually, when at rest, mandible is located 2 to 4 mm below maximum intercuspation or MIP, and this position is known as clinical rest position. More appropriately termed the postural position or PP, since it is not a true resting position. During chewing stroke, movement begins at the maximum intercuspation, drop downward and slightly forward to the position of desired opening, return back to maximum intercuspation in a pathway slightly posterior to the opening border movement.